In this procedure, you will learn how to prepare a patient's skin and remove hair at the surgical site to reduce the risk of wound contamination. Before you begin preparing the patient's skin, sanitize your hands.
So Dr. Anderson's going to be removing that cyst from your arm today. It's a routine procedure, but I do need to do some prep to the area before they actually do the procedure.
Explain the skin preparation procedure in a way the patient understands. Answer any questions the patient may have about the procedure.
Do you have any questions for me?
Is Dr. Anderson going to put me out?
No, not for this one. She'll be using a local anesthetic and just to remove that cyst. Do you have any other questions?
No.
Ask the patient to remove any clothing that might interfere with exposure of the site and provide a gown if needed.
Okay, then if I could have you put your arm up on the table for me.
Put on disposable gloves. If necessary, assist the patient into the proper position for site exposure. Provide a drape if necessary to protect the patient's privacy. Expose the site. Use a light if necessary. The area will need to be shaved to limit the potential for infection. Shave the required area with electric clippers. Shave carefully over the cyst area. Follow standard precautions regarding disposal of sharps. Apply antiseptic soap to a gauze sponge. Starting at what will be the incision site, begin washing the patient's skin with the gauze sponge in a circular motion. Move from the center to the edges of the area to drag contaminants away from the incision site. After one complete wipe, discard the sponge and begin again with a new sponge soaked in the antiseptic soap. Repeat the process using sufficient friction for 5 minutes, or follow your office's policy for the length of time required for a particular prep. Rinse the area with sterile normal saline solution. The area should be dried by blotting with a sterile gauze or using the same circular technique with dry gauze. Paint the antiseptic onto the area with antiseptic swabs, such as betadine swabs, using the same circular technique. Never return to an area that has already been painted with the same swab. Place a sterile drape or towel over the area. After the procedure is over, remove your gloves and dispose of them appropriately. Then sanitize your hands. Document completion of the skin prep in the patient's health record.